Hi, I'm Dr. Benjamin Lloyd. I'm the Internal Medicine Program Director here at Reading Hospital. Our program was founded in 1971 by Dr. Hildreth. We have 12 residents per year, 36 residents. The Reading Hospital clinicians are very energetic and motivated. Their passion is the outcomes of the residents, and so we are excited about teaching. We look for innovative ways to get that done, and we've created some nice systems to do that. We find it very important to learn what your goals are as you come in, and through the mentor system and the program director, we try to get you to those goals. And so if it be going into a hospital medicine or into a fellowship or ambulatory medicine, we can really tailor your experience so that we can get you to your goals and have you be a clinician that's ready to fly. We have a strong mentoring program where everyone has a mentor assigned to them that they meet with 3 times a year. In addition to that, because of our small size and ratio, our faculty get to know our residents very well. Your day at the hospital training program will start with morning report at 7 o'clock. At 7:30 there will be sign out, and then there'll be bedside rounds with the faculty member and the team. Then there'll be some independent time for rounding, and then there'll be noon conference. After that time, we start admissions at 1 o'clock, and we'll admit every 8th patient along with the hospitalists in a random order until your shift is over, which is 6 o'clock for the upper year. Our work schedule is with a night float system, and it allows us to have a fairly good schedule as far as a number of hours. So on the most rigorous service, the teaching service, our call is until 6 o'clock, and for the short call it's until 9 o'clock. And then the night floats work for the interns Sunday through Friday. We find that this really allows for a nice work-life balance, and the electives have a little more flexibility as well. We have an evolving disparities of care curriculum, and as a good part of that, we have a really robust street medicine program. We go out to several shelters once a week, and we have a night system where we go twice a month to the Hope Rescue. This is a required component on the ambulatory setting, and you go out with some attendings that are really motivated and show empathy toward some of the less fortunate in our community. We are a magnet hospital, and that's really exciting for us because of the relationships with nursing, so it allows us for quality and research purposes to work with them. We allow for research blocks up to every year during your residency, and we have good infrastructure with a research mentor and research advisory council. We have a really robust quality improvement program for our residents. It's a year-long program where we have didactics, but every resident is involved in a group that culminates in a presentation at the grand rounds at the end of the year. Our infrastructure with technology is very good. We have the Epic electronic system through the inpatient and outpatient settings and throughout our whole system, so it really allows for good communication. We have practically all specialties here at Reading Hospital. In addition, we have fellowship opportunities in some of the core internal medicine programs. Working here in the hospital setting, it's a very friendly environment. We find that our relationships with nursing and other ancillary services is very strong. And living in the community here, it's got a nice cost of living and a nice culture for a medium-sized city. We have some nice festivals, the Jazz Festival, the Arts on the Avenue right near the hospital are some nice things to do in the community. Because of the size of our residency and the relationships that we know the strengths and weaknesses, we are able to really allow ultimate autonomy growth as we go along. So very important for supervision balance, but I think that we are able to individualize autonomy and allowing them to be as independent as they are confident and comfortable with. I mentioned the mentoring system, but we also have a strong portfolio system. It's an electronic portfolio which allows for reflection and growth in all aspects of being a doctor, in addition to cognitive skills, those of interpersonal skills, quality improvement, relationships, and research. All are encompassed in there. And so I think we do a really good job at providing feedback and direction in those aspects. Our goal is to have our residents develop as strong colleagues as we go along. So we meet them in their internship year, and as we go through the 3 years, we view them as a colleague and allow them to work alongside with us where we learn from each other. I always look forward to my day because of the faculty that we have. It's really a good place to work. We have good collegiality, but most importantly, it's the relationships with our residents and students. And when the light bulb goes on, it really is a lot of fun to motivate them and see growth. We as a faculty are very proud as we see the growth of our residents and as they prepare to go out into the world on their own. It's probably the best feeling that we have. You can be confident that we are going to help you grow into the clinician you want to be.